to this episode of the Future Insight podcast. We're very pleased to have with us today Dr. Sarah Salvatore, Assistant Professor of Physical Therapy at Russell Sage College in Troy, New York. Welcome, Sarah.
Thank you. I'm very happy to be here.
Well, we're really pleased to have you with us today. And again, what we normally do on Future Insight is we start off by affording our guests with an opportunity to tell a little bit about yourself and sort of your life journey, which led you to this point where you are currently serving as assistant professor at Russell Sage College.
Great. Well, I'm an original Massachusetts native, and I went to Northeastern University in Boston for both my undergrad and Doctor of Physical Therapy. And it was there I got really interested in public health and sort of the health of the communities that are surrounding, the schools and businesses that we work in. So after almost 10 years of clinical practice, I moved into higher education. And at that point, I was in upstate New York, Troy, New York, which is outside of Albany, if you're familiar with the area. And I was practicing in orthopedics and in community health centers, I should say. And I was really intrigued at the diversity of our client base there, and decided that, I thought I could affect bigger change if I got into higher education, and ended up at Russell Sage College. So as part of my time there, I pursued a Doctor of Education degree, and I finished that last year. And now I am teaching full time and really loving every minute of it.
That's great. That's great. One of the things that is of interest in your research that is directly aligned with our focus at Future Insight is the research that you've engaged in relative to admissions criteria, graduate admissions criteria, going into a DPT program. I know that you researched and have talked a lot about non-cognitive factors and holistic review procedures. Could you share a little bit with our listeners what that focus has been in your research and what some of your findings have been?
Sure. So non-cognitive factors refers to anything that we would be looking at that are not like academic metrics, like grades, GPA, or GRE, or standardized test scores. So non-cognitive factors are all of the other things that we look at in a person: their resilience, their empathy, their leadership qualities, personality, that kind of thing. And I got really interested in this because I noticed that there were a lot of colleagues that I had that were wonderful physical therapists that kind of identified as poor test takers, or said their academics were not, really necessarily representative of how good they were at their practice in our field. So when I started looking into topics to research, I thought the admissions process was one really interesting area that we could look at. And holistic admissions has been kind of a up and coming term, I would say, over the last 10 years, where you evaluate the whole person. So those non-cognitive factors, those non-academic metrics, in addition to their academic metrics. But when we looked at implementing that in my own program, there was really very little guidance on, how to do that. So what my research was I actually interviewed 9 program directors for other physical therapy programs and asked them how they do that. Trying to find sort of common ground and best practices. And what really came out of my research anyway was that there is no best practice at this point. And it's kind of the Wild West. And, some programs implement some, policies and procedures really, really well, and some kind of don't really have a rhyme or a reason. So as we look as a field towards getting more people into PT and trying to get the people who are going to be great practitioners and great community servants, we probably need a method of evaluating those non-cognitive factors more than just saying like, okay, you have a 3.2 GPA, you get in or you don't. So that's really what drove my research.
Excellent. And talk a little bit about those non-cognitive factors as predictors, perhaps, relative to academic success and even potentially success once they enter into the profession.
Yeah, so I used a framework that was established by the maker of the GRE, and he divided non-cognitive factors into things like performance factors, which would be teamwork, leadership, effective competencies, that would be things like creativity, emotional intelligence, personality factors, so that would be things like extroversion, openness, that kind of thing. Learning skills, which are study habits or organization or time management skills, and then attitudinal constructs, which would be things like social attitudes and values. And I looked at it this way because when I was evaluating the literature as part of my research, there really isn't any single quality by itself that's predictive of academic success right now. And it's really hard to tease those out because if you look at psychological research, we don't really have great measurement tools for a lot of these things. So I tried to take a more broad approach. And a lot of the research that's coming out is individual school based. So you can look at, one program and say, in this program, they've got a relationship between empathy and success. But I tried to take an even broader approach than that because we don't have great tools to measure these things. So it really is based on the perception of the person who's doing the interview with the student or evaluating the application. Which has been a challenge in getting more concrete data on predictive characteristics.
Right. It sort of leads itself into perhaps longitudinal studies, which again, if this is sort of embryonic in its implementation, may not be there right now, but would certainly be something that we could engage in and learn from in the future. Because when you're talking about those characteristics, leadership qualities, teamwork, and attitudinal, constructs, those are all things, again, if you look at from an employer's perspective, those are things that they're looking for in a potential employee.
Absolutely. And so it translates directly into what's required as a healthcare provider, but really in any field. How well can you communicate with others? How well can you manage your workload? How well can you empathize with the patients or clients or what have you that you're encountering on a day-to-day basis? But right now, there's no great standardized method of doing that.
Right. And I was curious too, because I know that the focus of your research is on graduate admissions. Is there, in your lit review, is this something that is being looked at relative to undergraduate admissions across different, potential degree programs?
Yes. So most of the literature in my lit review was based off undergraduate admissions because it is just not robust enough on the graduate level at this point to draw a lot of conclusions. And then you get a lot of confounding factors. So students who may have had trouble accessing undergraduate education are much less likely to access graduate education. So I looked at graduate education because that's the field I work in. But there's certainly a lot of parallels between the two. And really the undergrad research is driving this.
Excellent. And talk a little bit about, I know one of your areas of research interest is in disparities in higher education. If you could kind of give our listeners a little bit of insight in terms of some of the research that you've been engaged in concerning that topic.
Sure. So a lot of this has to do with basically my lit review again, but it's looking at things that result in a lack of diversity on every level of diversity in graduate health professions. And interestingly, a lot of this has been replicated across STEM, in medicine, PhDs in the humanities, that kind of thing. But really, people from higher economic backgrounds or better socioeconomic backgrounds or who have more resources are generally able to access these programs at a much higher level than people who are from maybe less advantaged backgrounds. And a lot of the research talks about how we inadvertently cut those less advantaged people out of the pool by trying to ensure that somebody is capable of rigorous academic work. And a really great systematic review in 2019 by Walden et al. Showed that there's really no single academic predictor of success in a graduate physical therapy program. So what I've been looking at is, what can we use to assess whether or not a student is capable of completing a graduate program? Do they have the foundational knowledge, but also do they have the life skills to do this stuff, and how can we support them? So that's the second piece of it. All of this sort of leads to the fact that we still need to support the students that we're identifying as maybe having greater need than others. So that's what I'm looking at now. And our program is probably 2 years out from some data on this because we've just changed over our admissions program. But I know there's a lot of other CPT programs, and I'm certain other graduate level higher ed programs that have data kind of in the works on this.
Excellent. Thank you. We're going to shift a little bit here and talk about two of your other areas of research that you've been engaged in, community wellness and health promotion. So if you could, again, share with our listeners a little bit about the research that you've been involved with and some of the other activities you've been involved with concerning both community wellness and health promotion.
Sure. So I don't know if you are aware at all of the demographics of upstate New York, but we have both a huge urban population and then an extremely rural population. So the needs of those two groups of people are often really different in terms of transportation, access to healthcare, education, all of those things. And I'm really interested in how a school district or even, a healthcare center that services both groups can provide reasonable wellness advice. And we're talking like preventative wellness. So things like, getting exercise, having access to healthy foods, getting good sleep at night, those kind of things. And how we address both groups at the same time without, kind of missing anybody. So I've been involved in a couple different projects locally. We just did a really big one last year with a school district that really doesn't have any resources in a neighborhood of Troy. And we put on a big health fair where we had educational opportunities, we had snacks, and we had a registered dietitian come speak to both the students and the parents that were coming through the fair. And we tried to talk about, different types of healthy activity and how that can look different based on where you live. I mean, it seems to be very successful. We got great feedback from the community on it. And our goal is to be able to sort of implement something that is self-sustaining over time. But, with that challenge is a lot of funding needs. So we're working on that piece right now. The other thing that our program specifically is trying to do is we're trying to offer more pro bono care to the area. So can we use our faculty who are all experts in their areas and our students who are really driven often by this service mindset to help increase the health awareness in the community? And that's been great. So our students have, volunteered at health fairs. We have a pro bono clinic that we're getting off the ground right now. They've attended, there's a health center in this area that's not for profit and does some really wonderful community work. And they've collaborated with our students trying to offer educational opportunities for, the greater public. But it's very much a work in progress.
Well, and it sounds like though that it's what you're yielding is from partnerships, higher education, yes, as well as K-12, and also healthcare partners within the communities as well. I think that's sort of a pillar of these programs, is that partnership among those different entities.
I totally agree. And I think that's the only way to really access huge groups of people that might have needs in a way that's both sustainable in terms of manpower and in terms of finances. And our community partners have been invaluable to us. And, we have bodies to provide them that are interested in providing this healthcare education or this wellness education. We just often need venues or lists of people to contact or stuff like that. And it's been really fruitful and really great.
Excellent. Thank you. There's another topic that you've been engaged in that I found intriguing, and that is virtual reality. Specifically, you were involved in as a consultant with UC Santa Cruz on user experience of virtual reality system and app-based clinical dashboard for functional stroke rehabilitation. Could you share a little bit with our listeners about that, and then also sort of writ large, where you see VR within your field?
Oh my gosh, I think VR is going to be a tool that we can use for years to come. We just need to figure out how to do it a little bit better. So a couple of years ago, I was contacted by a research group out of that university. There's some PhD students working with some community partners. And if you're unfamiliar with medical terminology, a stroke is when you have an injury in your brain that usually causes some sort of deficit, either in sensory skills or motor skills. People often have a hard time moving their upper extremities after that. So what they were doing was developing an upper extremity rehab program that could be basically either done in a clinic or from the patient's own home using the Oculus video game system, which I have a family member with one of them. It's extremely cool. It's a headset and has like a little handle that you hold. And they had developed a platform that was sort of based off the Harry Potter series, where the physical therapist could go in and program ranges of motion or program the number of trials or certain exercises into the back end of the program. And then the patient would basically go through and use their upper extremity that was involved with the stroke to cast spells and move, their arm around. And that's how you get exercise. And the great thing about this is it's engaging for patients who are bored of stroke rehab, which is, a long process usually for many patients. And it's great for patients who can't access the clinic on a day-to-day basis. So if they have a system like this at home and we can then move a VR system to, their house, they may have access to physical therapy services that they were previously unable to access. So I thought it was a really great project. It taught me a lot about how people are working with technology to, solve some of the more difficult problems in healthcare. And I think it's amazing. If I was at all tech minded, I would absolutely want to implement something like that. But I'll leave that to the computer engineers for right now.
Absolutely. Now, I think you're right. I think in all of various professions, I think we're just seeing the tip of the iceberg relative to the integration of VR into our fields of study. I know here at my university, or University of Arkansas Fort Smith, we've got a simulation lab with high fidelity simulators, mannequins, but we're also looking at creating a virtual reality lab as well to accompany it. It's not an either or. We can have both our sim lab as well as a VR lab, and it's really something that just helps to enhance the learning experience for our students.
Oh, that is wonderful. And, for all of the difficulties the pandemic caused, the one thing that I think was, if we're going to look at a silver lining that came out of it, was the push to kind of use technology we already had to help us solve some problems that have historically been pretty challenging. So we love VR. I think there's some really cool physical therapy tools that are coming out, and really the research is supporting it as a way to increase access for people to that and to education. So it's great.
Absolutely, absolutely. Again, I just want to give you an opportunity here as we sort of close out this episode, Dr. Salvatore, to share with our listeners any other research or any other insights that you have that we haven't discussed thus far.
The main thing we are looking at right now is looking for something that might be a standardized measure to assess those non-cognitive factors. And from, what I've read out there are a few that are out there. They're tools that can be used. You can pay for them, and some universities do and use them very successfully. But what we found actually is they end up producing the same disparities we see in standardized testing, like the GRE or, the SATs or something like that. So we don't have a good solution on that, because that is one thing I've heard a lot about, is people moving towards these, non-cognitive assessments. But, the thing is, if you can practice for the GRE, you can also practice for a non-cognitive assessment. And generally that stratifies your application pool into, the haves and have-nots. So, that's where I'm really looking forward. I would really like to see some more there and see how we can make the application process to graduate programs a little bit more accessible without having to have the people who really, can afford a lot more than the people who can't. So that's what I'm looking forward to for the future, and I'm hopeful we'll see some movement in that regard as more data comes out over time.
Absolutely. Again, thank you, Dr. Salvatore, for being our guest on this episode of Future Insight podcast. And again, I want to thank the listeners for joining us. And until next time, take care and stay well. Thank you.
Thank you for having me.